So let's talk about the risk factors for breast cancer. Being a female is the greatest risk factor, obviously, but if you have a first-degree relative who's had breast cancer, so that would be a mother, a sister, or a daughter, then you have double the risk of developing breast cancer in the future compared to the general population. Also, 5 to 10% of breast cancers are genetically linked with two genes that a lot of people are familiar with, BRCA1 and BRCA2 genes, but that's only 5 to 10% of the population. That means 85 to 90% of the population is actually developing breast cancer spontaneously without a genetic link. If you do have a BRCA1, BRCA2 gene, you have about a 70% chance of developing breast cancer, and also you have a higher incidence of developing ovarian cancer. Age is a risk factor. The older we get, the higher the risk. 2/3 of the invasive types of cancer start at the age of 50 or higher. Also, if you've had a personal history, of course, you are 3 to 4 times more likely to develop cancer in the other breast or develop another cancer in the same breast. If you're overweight, if your body mass index is high, or if you're obese, so any BMI over 25 or 30 increases your risk of breast cancer because the fat cells actually make a lot of estrogen, and excess estrogen can cause harm to the body, especially for the estrogen positive or the hormone positive type of receptor breast cancers. Also, if you've not had had a child and carried it through to full term, or you had a baby very late in life, we found those women tend to have a higher risk of breast cancer as well. Alcohol is also known to increase your risk of breast cancer, as alcohol has some type of estrogen type properties, and it also causes cellular damage. So if a woman drinks 3 to 4 glasses of wine or beer a day, she has about a 15% increased risk of breast cancer. If she drinks more than that, she has an additional 10% risk of developing breast cancer in her lifetime. So smoking is also a risk factor for younger women. If they themselves smoke, it puts them at higher risk. And older women, postmenopausal women, if we've even inhaled secondhand smoke, that increases our risk of developing cancer. Eating unhealthy has also been linked to a lot of different cancers. It's not so much that eating healthy prevents cancer, it's when we don't eat healthy, we don't eat mostly a plant-based diet, there are chemicals that are formed, such as in meat that's been burned or barbecued and charred. There's a chemical that's released called HCA, and that has been known to propagate cancer, as well as PAH, that forms when smoke drips onto hot coal and it releases the chemical. So those have been known to propagate cancer. A lot of people have talked about maybe antiperspirants increasing risk of breast cancer, wearing an underwire bra, or wearing a bra at night when you sleep, and those are just misnomers. There's been no proof to show that that would increase your risk of developing breast cancer. Now let's talk about what we can do as far as like prevention goes. So obviously getting a mammogram is probably the most important thing, and doing self-breast examinations. There are a lot of different agencies out there that tell us what age we should start testing and also how frequent. In general, most agencies agree that we should start testing at the age of 40, and it should be done on an annual basis, and up to and through around age 74, 75, but that's really between you and your doctor. If you have the possibility of living an additional 10 years beyond that, then you really should be tested. So that's a conversation that you need to have with your physician. So breast cancer awareness is extremely important. We've seen the incidence rates of breast cancer come down since 2000, and we think it's first because women aren't taking as much synthetic hormones for prolonged time periods as they had been, especially after the Women's Health Initiative study came out in 2002. And also we have better ways of detecting. The 3D mammogram is more sensitive in picking up smaller lesions and calcifications, and women are more aware, and they're going to their doctor and getting tested and having a breast exam done. So please remember, this month is to make everybody aware. Breast cancer, if it is caught early, our treatments have improved dramatically, and lives can be saved by doing a simple test. Thank you.